Good afternoon and welcome to H360 Live. My name is Dave Duplay and I'm joined here in the studio today by my colleague Cortland Long from H360. And joining us a little later we have Lisa Hoffman. Lisa is coming in. We're going to be talking about exercising and particularly during cancer treatment. We have a very exciting show for you today, so let's jump right in. I want to talk about an interesting study, and this is something that's very, very important. And I really want people at home watching this to pay attention to this first thing we're going to talk about. Cortland, did you know that only about 3% of the online pharmacies are legitimate? And that statistic is according to the US FDA. So if you imagine you go online, you go on Google these days and you Google something and you're looking for your medication online, and only 3% of those pharmacies are legit. Cortland, there's been a study about that, and what do we know about the study?
Yeah, so those pharmacies online that you're just talking about, they employ a couple tricks to lure you in and make you think that they're legitimate. And one of the big ones that they do is they put the Canada in their name, so they try to pass themselves off as a Canadian online pharmacy. And Libby Bainey, the director of the Alliance for Safe Online Pharmacies, she says that, even if you see Canada in the name, that doesn't necessarily mean it's a legit Canadian company. The World Health Organization finds that 1 in 2 medications, so we're talking 50% of these medications are counterfeit. And that's a staggering statistic because these counterfeit medications can have some very dangerous chemicals in them, such as boric acid, lead, highway paint, and it's quite dangerous.
Highway paint in the medication.
Yeah.
And so that's why this is so important, right? So, and I take it that because the website may say Canada, they're not actually coming in from Canada?
No, they are not. A lot of the 4 main countries that these medications are coming in from are Turkey, Russia, China, and India. So they're not anywhere near Canada.
And so how do I identify a legitimate online pharmacy from one that is not?
Well, that's a very good question. There are 3 things that you can do. One is to check the National Association of Board of Pharmacies website, see if it's a legitimate website. The second one you can do is visit legitscript.com, enter in the name of the company and see if they are an approved company. And then also buy to the right of the dot. So pay attention to the domain of the pharmacy and make sure that that pharmacy is a part of the domain that you're searching on.
Yeah, very, very good and very important. So, I would really urge you to pay attention when you're looking for your pharmaceuticals online. Again, only 3% of these online pharmacies are legit. And as Cortland mentioned, there's some very bad things that are coming into the country in these bottles. So it's really important to pay attention and to find a legitimate pharmacy and go to these websites that we mentioned to check that out.
Another thing, Dave, that I want to talk about today is, health tips for summer. So the weather is heating up. People need to start paying attention to their exposure to the sun, and I think you have some good tips for us.
Yeah, I'm all about the summer and the warm weather, and we are hitting that point of the year here in the Northeast. And so there are some things that I want you to look out for during the summer, and one of those is heat stroke. And heat stroke is a severe hyperthermia. It occurs in the human body and absorbs heat that can't be dispensed or dissipate out of the body. And so heat stroke in the summertime is a very serious thing, especially for the very young and the elderly. It's important for everyone to know, but the young and the aging really need to pay attention to heat stroke. And I think there's some remedies that we might have for that.
Yes, there are. So you can take an ice bath or a cool shower, drink cool liquids, and wear some light and loose clothing.
Yeah. The next one is heat cramps, and you're going to notice this pattern. It's all about heat. So the next one is heat cramps. And when you get overly heated in the summertime, do you ever notice that your muscles will tighten up, especially in your abdomen and around your core? And what you're experiencing is heat cramp syndromes. And I think we have a couple of remedies for that.
Yes, we do.
Yeah.
So rest in a cool place. Again, drink cool liquids, clear liquids with electrolytes. And once the cramp has subsided, try not to go back to the strenuous activity because it can induce heat exhaustion or heat stroke.
Yeah, heat exhaustion is actually our next one. Heavy sweating, weakness, dizziness, headaches. Again, the young and the elderly have got to really pay attention. And so if you're experiencing a lot of sweating and dizziness, really pay attention to that and get in out of the sun.
Mm-hmm.
Yeah.
Yeah, resting and drinking cool non-alcoholic beverages is very important. Taking a cool bath and again using light clothing.
Yeah, and getting back to drinking beverages with electrolytes, dehydration symptoms is very big. So dry mouth and eyes, dry skin. If you're experiencing those symptoms, chances are, and you've been out in the sun, you're experiencing dehydration. So really get in there and drink a lot of water, a lot of fluids. And Cortland, what else can we do if you're experiencing that?
Yeah, well, so you just went over some great prevention tips of drinking water and clear fluids. And you can also use fluid replacement once you're suffering from dehydration. And you can take some over-the-counter fever-reducing medications as well to help with that.
Yeah. Now we're going to shift a little bit to skin issues from the summertime. And rosacea is one of those. And I have a little bit of Irish in my background, so my cheeks are always a little bit red. But how can we prepare and be wary of skin rosacea in the summertime? What can we do?
Well, wearing an SPF sunscreen of 30 or more is very important for anyone, I think, but especially for people with rosacea.
Yeah. The next one is prickly heat. You're out in the sun and your skin feels very prickly. And so what can we do to, how do we recognize it and what do we do to eliminate that?
So we, again, take cold showers. That's a big one in this list, using talcum powder, medicated or regular, and light and loose clothing.
Yeah. And of course, in the summertime, people go to the beach, and so one that we have to be a little wary of is a foot infection, right? So you're out and you're in flip-flops or you're barefooted and you're walking on the beach, and a lot of times, you're picking up, sand and gravel, and so you really need to pay attention to that. What do we have, and what can we do to eliminate foot infection?
So there are a lot of medicated powders that you can buy from your local pharmacies. Be sure to scrub your feet very well and in between the toes, dry your feet completely and apply the medicated powder. Yep.
We have just a couple more. The next one is summertime dandruff. And it's almost counterintuitive because you're sweating a lot and you feel like your scalp is moisturized, but it really isn't. And there's probably not a lot of home remedies, but if you're experiencing a lot of summertime dandruff, go to your doctor, your dermatologist, and they can, recommend a prescription drug for that, a shampoo. Moving along, we have summer diet, and I know we've talked a lot about this on a couple of our shows, and summer foods and eating a lot of vegetables. What are some of the great things that one can do to alter their summertime diet?
So your summer diet is actually very important because when you sweat in the summer, you lose a lot of nutrients and minerals. So to bring those back into your body, eat a lot of fresh fruits and vegetables in the summer. That's very important. And you have to choose your fats carefully. So a lot of times in the summer, people want to diet and go on the zero fat diet, but it's important to still incorporate healthy fats such as avocado. And use those sparingly though.
Yeah, and so just as it's important to have good hygiene on the body, in the summertime, good food hygiene.
Yes.
Right, we're out, we're barbecuing, we're eating out a lot, and those little nasty critters keep landing on our food. So keep some cellophane around, some saran wrap, right, some tinsel foil, and make sure that your food is covered up. And don't leave your food sitting out in the sun. Because you're going to experience, and that creates bacteria. So food hygiene is very important.
Proper refrigeration, not cross-contaminating your cutting boards and your knives, very important.
Absolutely. Well, it's almost time to have Lisa come into the studio, but before we do that, We've had a couple questions come in from last week, and I want to address a couple of these. So Bob G. from Springfield, Massachusetts wants to know, do we ever have any plans to broadcast outside of New York? Our show, our H360 Live outside of New York. Well, Bob, as luck would have it, we do have plans for that. Not immediately, but I have this vision of going across the country in a Winnebago and broadcasting in different cities and talking to different people, because as you know, Healthy O360 is all about real people, real stories, and real life. And so we are going to try to figure that out. We're talking to a few people that are going to sponsor that Winnebago, so if anybody sees the Healthy O360 coming down the road, stop us. We'd love to hear from you and chat.
Yeah.
So it's all in the plan. Corlin, this next one is for you, actually.
Okay.
Linda S. from Tulsa, Oklahoma wants to know, she sees your name appear on the broadcast, and she wants to know, what is MPH? What are those initials after your name?
That's a great question. So MPH stands for Master of Public Health. So I got an advanced degree in public health, and I learned all about nutrition, creating health programs, health communication, how to evaluate health programs, and so much more. I can't sum it up, in 30 seconds, but that's a little taste.
Wonderful. Well, thanks for
Yeah.
that. Now, into our studio is Lisa Hoffman. Lisa, thank you for coming in today. Lisa is the founder and CEO of Solo Fitness and Wellness, a consulting firm, and you work with clients who are going through cancer, and you help them with their fitness. Lisa is also an author. This is one of her 2 books that she has out, and this book is The Healing Power of Movement. It's a fantastic book that we're going to talk about. But Lisa, I have so many questions for you. I remember not so long ago that if you were diagnosed with cancer, your physician would say, slow it down, take it easy, minimal, if any, exercise. But yet now it seems like they're saying the opposite, and exercise is so important through your cancer. Tell us what's changed.
Yeah. You're correct, Dave. Historically, clinicians would tell their patients once they're diagnosed with cancer to rest, to avoid activity. However, research has come out more recently to state that they're challenging this myth, that in fact it's counterproductive and it'll be beneficial to participate in physical activity once you're diagnosed with cancer and throughout your whole course of treatment and beyond.
Wow. So, but it's not only beneficial when you're diagnosed, right? So we kind of divide it into 2 camps, right? Pre-diagnosis. And so what are we focused on there, and how can that help? And as I got to know you a little bit before the show today, and so there are significant benefits in that as well. And so let's talk about the pre first and what we know about that.
Sure. Certainly exercise is not a cure for cancer. And exercise isn't one of the only things that prevent cancer and also to treat cancer. So if we look at that. However, research has shown that it plays a vital role in cancer prevention and cancer control. So if we talk about the cancer prevention side, so let's see the physical activity that prevents cancer from ever happening. So we can have cardiovascular fitness, and we have strengthening, and there's stretching, and all different types of sports that you can do. And there was an interesting research that came out on the prevention side just recently, and this was from the Cooper Clinic in Texas. And this showed over 14,000 men looking at physical activity, or actually cardiorespiratory fitness. So that's full body motion, big muscle groups over a sustained period of time. So that's running and walking and jogging and biking. And they looked at that, and they looked across the board from years and decades prior to a cancer diagnosis, and did this make a difference? And in fact, they showed that it decreased incidence by 1/3 if you had high cardiorespiratory endurance for lung cancer and colorectal cancer.
Wow.
And this was pretty exciting, because this was really one of the first it was an observational study, it was a prospective study, so you looked over years of time, and they looked at Medicare age at 65, did these men, were they diagnosed with cancer? They didn't see, though, that cardiorespiratory fitness, a high end, had any effect on the incidence of prostate cancer. But was very interesting and a take-home message for all of this, that if you were diagnosed with one of these three cancers, that your life, that there wouldn't be a specific cause of death due to your cancer if you had high cardiovascular fitness. And that is pretty exciting.
Yeah.
That is exciting. And exercise also helps to delay obesity. So, and I understand that there is a unique shift happening from smoking being a leading cause of cancer to now obesity.
Yeah, kind of incredible how, it seems that with the National Cancer Institute, they're showing that they think that obesity is going to take over cigarette smoking for the #1 preventive cause of cancer death. And that's kind of seismic that we can make a change. And so what happens?
Are we eating more? What's causing? Are we eating more? Are we smoking less, or a combination of the two?
I agree. I think there's a combination of both. I think, the smoking message is out there. I think we're decreasing our incidence of smoking here in America, especially, the rules and the laws have changed. We can't smoke inside. It's making it, it's getting very difficult for people to have this habit.
Yeah.
It's an expensive habit, so I think things are shifting. However, on the obesity side, people can tend to, have a bigger waistline. But what's interesting too in the exercise world, in cancer prevention, that exercise seems to be an independent risk factor for cancer. So that means if you're physically fit and you have an active lifestyle, no matter what your BMI is, and that's body mass index, so it's independent of your weight. So it's kind of exciting that there's some biological markers that exercise alone can decrease incidence of certain types of cancer. And certainly we see that a lot in breast cancer, we see that in colon cancer, in lung cancer, and a little bit on the endometrial side, but also in some literature, it's up to 8 to 10 cancers that exercise can prevent.
Wow. So tell me how you get started. You're in the doctor's office and you hear those unfortunate words, you have cancer, and your physician now recommends an exercise regimen. I know you have a little squeezy ball here, right, that you work with clients on, and I know you do a lot of work with those elastic bands, right, the resistance bands. How do you get started? What's the process of, when you work with a client, how do you get them into an exercise routine?
Yeah, that's a very good question. First, as you said, that when the doctor recommends, your clinician will recommend physical activity to help support your cancer treatment. First of all, I hope physicians and oncologists or radiologists or nurse practitioners would recommend exercise or physical activity for their patient. It's kind of the last thing on the list at times, but it's really quite important. And they're finding out that there is something that we can do. It really does depend on what happens before that line of diagnosis. Is this a habit? Are you physically active? Do you like to do it? Are you, do you do fitness? Do you do wellness? Do you like to exercise? Do you like to play sports? A lot of people I know, we don't play treadmill and we don't play stationary bike, but people play soccer. And here we are in New York, and our clients are mostly here in New York, that we walk everywhere. So we're weight-bearing, aerobic activity, protecting our bones.
Sure.
So that's a good starting point. But if there is a recommendation that, now it's time to get started and I want to do something to take care of myself, it actually helps patients, once they're diagnosed, to help to be proactive in their treatment plan. Sometimes you feel so helpless and that you're being told where to go and what to do. This is something that people can say, I can take charge of, I have a choice, and I can make some changes here. And so it's a really wonderful time to start an exercise program. And there's actually research in the breast cancer community that decreasing risk of recurrence in breast cancer, and actually in colon cancer too, but it doesn't matter if it's before or after the diagnosis. And some more studies are coming out to say if you start exercising post-diagnosis, there's a benefit.
That's very interesting. And you don't have to go to a gym. There's things you can do, right? And we can, in your book, The Healing Power of Movement, it doesn't have to be lifting a lot of weight. It's about movement. It's about flexibility. It's about stretching.
Right. It's about practical.
Practical.
It's about practical and your quality of life. You know, it started when I wrote the book. It really started from a client who was undergoing cancer treatment right before her bone marrow transplant, and she wanted to take a bath. And she couldn't take a bath because she didn't have the confidence and the strength to get out of the bathtub. And that was her simple task. So that was our goal. Our goal wasn't to cross the finish line to do a 10K. Our goal was to get out of the bathtub safely. So that meant core exercise, core work, upper arm movement, how to transfer your body through space, coming over the lip of the bathtub. So coordination, and on one foot and the other, and find balance, and then get your towel and wrap up. So we exercise, we did a program together, and a couple months later, I remember she called and she said, Lisa, I took a bath.
Wow.
Well, if that's not success,
Right,
I don't know
right.
what is, and I send her some bubble baths to congratulate her.
And so that's practical. You said it's
Practical. Practical. And that's also why the book was called The Healing Power of Movement, because exercise means different things to different people.
Yep.
So in the very beginning, when we were starting to work with our clients who one day open the door and say, I have cancer, what are we going to do? That, you know, part of my physiology hat said, well, we have to get medical clearance of what to do. And we're asking the doctor, does she have clearance for exercise? Exercise, no.
Right.
So I kind of wrote the doctor, the oncologist, a note to say, we're walking around the dining room table. We're sitting on a chair and we're lifting an arm up. We're stretching her chest. We're stretching out her back because her bone marrow test was there.
Yeah.
And so we need to stretch her out a little bit. She's been sitting in a chair and she's kind of hunched over this way. So we want to open up her chest. And that's physical activity. That's exercise in my book, but not in theirs. So once we're on the same page,
Sure.
we were home free.
Yeah.
So
Now,
sorry.
go ahead.
You're finding that you're having to sort of educate physicians as well about what exercise in this community means.
Absolutely, absolutely. And this has been a long time already. You know, it's been 15 years of when the book first came out until today. And sometimes you feel like you're repeating yourself over and over, but you kind of understand everybody's there, you know, they want to heal their patient. You want to protect them, but you also want them to, you know, have a full life and engage in their life, and also have the energy to do what you need to do. You know, you still may have to go to work and make your bed and go get your groceries and have a life and drive the car and be alert and cognition. And you know, we can talk about the benefits of exercise post-diagnosis and during treatment, because that's kind of a huge, you know, there's huge benefits there.
Yeah. Now, where can we find the book?
You know, right now the book is online.
Okay.
Everything seems to be online.
Yeah.
So you can go to Amazon or you can go to Barnes & Noble and just kind of Google The Healing Power of Movement by Lisa Hoffman, and
Yeah.
I hope it pops up.
It's a fantastic book. I've gone through it. A lot of great information here. I want to shift gears just a little bit. We've been focusing on the patient. And what do you have for the caregiver? Because we've talked several times on the show about caregiver burnout. And it seems like the caregivers are, you know, they're tired, they're run down, they're spending a majority of their time caring for a loved one, and they really neglect themselves. Do you have a program for caregivers?
You know, perhaps not as specific, but it's very important, because I think as a caregiver, as an adult taking care of anybody else, if you're a parent taking care of a child, you're only as good as how good you are,
Yeah.
and if you're rested. So if it's caring for a loved one who's going through treatment and the psychological, anxiety and depression, all the other things that can happen, then we need to take care of ourselves at the same time. A lot of times when I start to work with caregivers, it's when the patient is taken care of. So it's during their treatment, or it's when they're working with somebody else that they can step aside, because there's guilt a bit on, all right, I'm going to go out now, I'll be back. But it's kind of okay that I'll be back. And now with cell phones and emergency contacts, we can kind of do that.
Yeah.
So I see that your vest says PACT. Can you tell us what PACT means?
Oh yeah, this is something I'm very proud of. This is an exercise program that I started. It kind of evolved from the book, The Healing Power of Movement, and also from working one-on-one with clients. But I thought, wouldn't it be great to get various types of cancer survivors? And a survivor now is the terminology we use it from the moment of diagnosis.
Right.
It's considered you're a cancer survivor. So why don't we get a group of cancer survivors together in the class. It doesn't matter what kind of cancer they have. It Doesn't matter if they're, in treatment, post-treatment, they kind of come together and form a community. And what if I can come up with an exercise class that will, work all different levels, all different types? Because what I've learned throughout the years is that we match the movement to the moods and the feel of what you're going through. Mm-hmm. The book isn't divided up between breast cancer and colon cancer and hematological cancers and gynecological cancers. It's divided on how you feel. So when you're kind of feeling down and out, you come to the class and you sit on the chair. If you have a little more energy, you stand up. And we do exercise bands and we do squeezy balls. But what it is, it's social, it's a support group amongst itself. And what I pride myself in the PACT class is that it's a stop-start class, but our focus is on short-term and long-term side effects of treatment. So there are neuropathy points. It's brain cognition, so you have to think it through because of chemo brain. If there was surgery and you have an impairment or impingement in a shoulder and certain joint, we work that area and we open up that joint. We work on bone density, we work on coordination, and we work on breathing. Mm-hmm. And PACT stands for to participate in physical activity during cancer treatment and beyond. Mm-hmm. So I always tell my students, we're going to make a pact for life.
Yeah, and beyond. That's an important part of the equation, right?
And beyond.
If somebody who doesn't live in New York wants to find somebody like you, and they go online, what should they look for? Because I think you're much different than a personal trainer. So if they want to find somebody like you, what is it they should be looking for?
Right. Well, that's a good question because back in 2010, the American College of Sports Medicine and the American Cancer Society kind of got together and decided, let's give accreditation for fitness professionals who choose to work in this population. And how do we measure and what's our quality control that these people know what the heck they're doing?
Right.
So there's a certification out there now that I not only took online, but I also teach on behalf of American College of Sports Medicine. And I also teach with the PACT program that I also teach other fitness professionals on how to go teach the class and also work with one-on-one with clients. But the American College of Sports Medicine has a network. If you go on to their website at acsm.org, you can go plug in cancer exercise trainers and your zip code, and it will come up for certified trainers, physiologists in your neighborhood.
So that site again was?
acsm.org.
acsm.org. Okay.
And you're looking for a cancer exercise trainer, certified.
Got it.
A wonderful resource.
Yeah, fantastic resource. Well, that's all we have time for today. I'd like to thank Lisa for coming into the studio and sharing this important information with us, and of course, telling us all about your book. I'd like to thank the viewership at home for tuning in. And last but not least, I'd like to thank our sponsors for making this all possible. Remember, all of our episodes can be found on demand at healthyo360.com. And Healthyo360 can also be found on Facebook, Twitter, Instagram, and Pinterest. And please don't forget to use the hashtag #RealStories when posting. So on behalf of Cortland Long and everyone here at Healthyo360, we hope you have an enjoyable afternoon, and we look forward to seeing you again next week.